Hello everyone, my name is Shay Roddy. I'm one of the radiology registrars in Nine Wells Hospital. Thank you very much for checking out this poster, which I, and alongside the colorectal surgeons and other radiology colleagues, looked at preoperative coronary artery calcification in patients undergoing potentially curative colorectal cancer surgery. So before colorectal cancer surgery, they have a preoperative assessment which aims to optimize the medical comorbidities and stratify the risk of adverse outcomes following surgery. And coronary artery calcification has been shown previously to predict future cardiac events and long-term survival. So we wanted to see and investigate a correlation between coronary artery calcification and recognized risk factors for heart disease using the ordinal coronary artery calcification score on preoperative CT. We took 50 patients undergoing colorectal cancer surgery in 2017/2018, and we looked at their preoperative assessment clinic and we reviewed all of their risk factors. These patients then underwent staging CT scans which were reviewed by two observers who were blinded to their clinical variables. And then these patients were classified as either having no coronary artery calcification, mild coronary artery calcification, or severe coronary artery calcification. Table 1 demonstrates the results of this study, which shows the amount of patients who had no or mild coronary artery calcification and severe coronary artery calcification according to the different risk factors identified, including male, sex, if they're greater than 70 years old, if they were diabetic, prior MI or heart disease, and the results are demonstrated. 22 patients had no or mild coronary artery calcification, whereas 56 had severe. Severe was observed more commonly in male and patients over 70, but not in those with diabetes, and a history of heart disease was noted in 8 patients. 28% of the patients with severe coronary artery calcification had a history of heart disease, compared with no patients in the no or mild coronary artery group, and 20 patients with severe coronary artery calcification had no documented cardiac history. So, in conclusion, the incidence of preoperative coronary artery calcification is high, and what strikes us is that a high proportion of patients with severe coronary artery calcification had no documented heart disease. So identifying this in asymptomatic patients may represent an opportunity for additional risk factor modification and possibly optimizing or reducing the risk of adverse outcomes following surgery. And this need requires further attention with prospective observational trials. Thank you very much for listening to my poster presentation, and I hope you enjoy the rest of the conference.